Start reviewing some topics that we had from the previous lectures. So let's start with your PTCA. Okay, so we have your PTCA. So it's called Percutaneous Transluminal Coronary Angioplasty. So this is your percutaneous transluminal coronary angioplasty. Yan. So this is a procedure which is involves opening, sabi nga natin, opening of your coronary artery. So opening because sabi nga natin before, opening, this is due to a blocked coronary artery, no? So that is why we've used the word opening, no? So this is a procedure that we open we open the coronary artery so that it would have a the blood flow will be restored to the part that has been blocked, no, for the longest time. So nagkakaroon sila ng myocardial infarction, 'di ba? Kasi there is no flow doon sa part ng muscle which is your myocardium. So if we would go back, kaya nga remember, 'di ba, nung sinabi nating MI, myocardial infarction, there is actually a coronary artery disease, no? That is the cause nung decrease in the flow of blood to the heart muscle. So ganun siya, no? So then PTCA is done, no? PTCA is done to open the coronary artery. So ganun ang ginagawa natin sa PTCA. Before your PTCA, meron pa tayong ginagawa before that. So we do your coronary angiogram. Okay, we call it CA, your coronary angiogram. So coronary angiogram. So this is naman the visualization. So if the PTCA is the procedure that we do to open up the coronary arteries, so the diagnostic procedure that we do first prior to that is coronary angiogram. This is actually visualization of the coronary artery, so that we can see if there is a presence of blockage, no, to check to see for the presence of blockage. So yun, no. Tapos again, si coronary angioplasty is the procedure that we do sa cath lab, no, do sa cath lab to open, no. So this is to open the coronary arteries, no, yung mga diseased coronary artery natin. So ito yung we use a balloon tip catheter. So ang word dyan kapag meron kayong exams, no, ang keyword dito is we use a balloon tip catheter, no, balloon, okay, tipped catheter. Okay, so ibig sabihin may balloon na nag-i-inflate, deflate sa dulo nito, no, as described before, and may drawing pa ako niyan before. So halimbawa kung balloon tip, so paano ba, halimbawa ito yung dulo, ito yung catheter mo, no? This is your very tiny little catheter, no? So ganyan, 'di ba? Ito na yung dulo ng catheter natin, no? So meron yan ditong na inflatable na balloon na sobrang liit lang yan, sobrang tiny yan. Tapos pag i-inflate yan, lumalaki yan siya, lumalaki yan siya. So pag ini-inflate, so lumalaki yung balloon. So pag nag-i-inflate, ganyan. So yan ang ating balloon tip catheter, no? So kaya siya tinawag na balloon tip. So it can be inflated and deflated, so ganyan na makikita natin, guys, when you see when we do PTCA, no, for this patient. So pwede naman we do pwede ba isahan? So sabihin natin, we call it double setup, no? So we do first your coronary angiogram, then we do PTCA na, we do angioplasty. So ganun yan. If a question, if you ask me if you can do it on the same time, so yes, no, sabi natin, lagay natin dito na can it be done on the same time, so definitely yes, no? So the answer is yes. So we call it double setup. So pero what's the most important thing before these procedures, no? Sabi ko nga sa inyo before, when you do these procedures, no, there are nursing considerations, no? Sabi natin the nursing consideration should be na before the procedure, no, pre-procedure nursing considerations. Yan. So number 1, allergy, no? Very important yung allergies, no, ng patient. So allergies to what? So again, if you have to take note and ask the patient if they have a allergy to iodine, no? So allergy to iodine, no? Kasi one of the key ingredients ng ating what we call that, yung itong dye, contrast media, no? So your dye, yung contrast media is iodine, no? Iodine. So we have to ask if the patient has a allergy, no? Allergy to iodine or shellfish, shellfish. So yan. Meron tayong shellfish. Yan. So any allergy, no, to shellfish. So kasi kapag meron, syempre can we say we cannot proceed with the procedure? No, pero definitely kasi we can still proceed, but we have to change the contrast to non-dye, no? So kapag the patient is says yes, no, 'di ba? If the patient says yes to allergy, no, so gagawin natin lang naman yan is to change the contrast media. You have to change it. You have to change to non-dye, no? Non-iodine pala. Yan, non-iodine na contrast media. So that's the remedy to that, no? So yan. So ano pa? Number 2 is or the other nursing considerations. The another very important nursing consideration is we check for the kidney function, no? Check for the kidney function. So what we do is we check the creatinine, BUN. Yeah, check the creatinine, BUN. So what's the purpose of this, no? These two very important laboratory. Okay, again, this is because of your dye, no? This is again because of the dye or the contrast media. So contrast media is nephrotoxic. This is nephrotoxic. So meaning it kills your kidneys, no? It kills your kidneys. So yan ang problema natin with the contrast media. So before the procedure, no, ng angiogram or angioplasty, so we need to check this. So we make sure na you have a good functioning kidneys. So we make sure again, we make sure that we have a good and functioning kidneys. Good functioning kidneys, so that we can excrete, so the body, the body can excrete, no, or the body can remove the contrast media. Yan. So yan yung very important. Why we do check for your creatinine and your BUN. So nurses have to be aware of the normal value ng creatinine and your BUN. So the normal value of your creatinine and your BUN is, si creatinine is 0.06, 0.6 to 1.2. So more than 1.2 will be very bad for the patient. So more than 1.2 is a no-no, and you have to refer it to the healthcare provider as soon as possible. So more than 1.2 again is a no-no. This is a no. So you have to report to the healthcare provider. So yan ang very important thing to do. Okay, so for your BUN, your normal value is again 10 to 20. So definitely if you have a increased creatinine, probably your BUN will also increase. Now, so again, note for a BUN of more than 20. Okay, so that's your nursing considerations, no, prior to coronary angioplasty, coronary angiogram, no? So ito yung procedures. So what will be the one of the complications, no, that nurses needs to know while doing the it's either intra. So syempre during the procedure, kung intra muna, no? So if you talk about intra during the procedure, so complications. So complications, talk about complications. So halimbawa during, no, intra. Okay, so intra would be number one concern natin most of the time is, kaya sinasabi ko yan kapag surgeries, anything that involves surgery, number one priority during the procedure would be bleeding, diba? Always and forever yan. So it will always be bleeding, no? So bleeding during the procedure. So dito pertains to your PTCA, no? Atin naman ang location is percutaneous, no, via the skin, no? So tandaan nyo, it's percutaneous via the skin, no? So percutaneous via the skin. So lagay ko dito. So again, ang insertion site naman nito, insertion site is percutaneous via the skin, no? Percutaneous, no? Or the skin. So tandaan yun, percutaneous or the skin. So ito the site, no, the usual site that the catheters will be inserted is sa radial artery. Yan. So it's radial artery. Yan. We have your we have the and your femoral artery and your femoral or femoral artery. So if in case there is a massive or extensive artery disease, no, so which sabi natin it involves almost, no, daming site ng mga arteries niya are diseased, no. So we can use though not a standard practice, no, so can the carotid artery, no, be accessed, no? Can it be accessed, no, to navigate to go to the coronary arteries, no? Definitely yes. So pero again, what I've said is this is not the standard site ng access, but in case of there is a vascular, no, there is no vascular access na available, so due to the extensive peripheral artery disease, so we can access, or the doctors can access the carotid artery. So again, lalagay ko lang dito when there is no other access, no, so lalagay natin yan. So they use this only, okay, here when there is no other access available. Okay, so yun when there is no other access available.